Hi and welcome to another video from the CTAG Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. Today I'm going to be looking at a subscriber question from Faith about having DID and problems with employment. So Faith's question was this: could you please talk about employment and DID? We didn't have a problem with work before we knew about the DID. Now it's impossible to hold down a job. Can you help us with that? How do we work through? We need to work in order to survive. Thank you very much for that question, Faith, and I'm sure it's a question that a lot of people do struggle with when they have DID, dissociative identity disorder, and it could also really affect, I think, of any other aspect of complex dissociation, because the nature of dissociation is about the fragmentation of experience and life and history and trauma. So holding down a job would be difficult in a way that almost any aspect of life could be difficult with a disabling condition such as something like DID can be. Not everyone is disabled in that way in terms of work. Within the CTAG clinic, we have many people that we see, many patients who are in employment and many who are not. It's entirely variable. It comes down to the individual. It comes down to the nature of the job that a person has. What we do know, though, is that work is incredibly significant for lots of people because they need to work in order to survive, exactly how Faith has said it. Being able to earn money, being able to have a significant routine, reasons for getting up, reasons for doing things, motivations, commitments, relationships, all of these things are very important. And when we're diagnosing DID, one of the aspects that is within the diagnostic questioning is that ability to be able to work, to have that consistent, reliable framework in order to structure everyday life. Work does this for many, many people, so not having work represents many, many problems for folks with DID. One of the questions that we always look at with this is whether it's actually safe to work. So the nature of the employment that a person might have or might want to have might mean that actually having DID is going to be fundamentally impossible. So, for example, high-risk occupations or occupations that require an absolute level of focus and concentration. So, for example, working in a hospital or working on a building site, those kind of employments are very different from, say, working from home, where you can stop working because you feel that a dissociation is coming on, or there might be a switch into an alter is coming on. You can take 10 minutes, 15 minutes, come back, pick the job up and carry on. Whereas within, say, a public facing job or a risk job, such as, say, driving a forklift truck or working in accident and emergency, it's absolutely not the place where dissociation is going to be possible. It would be unsafe to work in those kind of environments. So looking at Faith's question, one of the things that I would want to know is, well, what kind of jobs are you looking for? Are they the sort of jobs that would be structurally possible for people with DID to take on in terms of the risk? What happens if dissociation takes place? Is it possible to share that DID exists with an employer or with people in the public? So let's say you might work in retail, you might own your own business, own your own shop, and it would be fine. You can say to people, look, just in case something strange happens, this is why it is. Or you can take time out, you can close the shop if you're not feeling well, that's absolutely fine. People come back in 20 minutes, it's all good. Other types of work simply not possible at all. So, there are going to be many, many factors and many variables involved in a question like this. It's not going to be pretty simple. What we do know, though, is that where people do want to work and they are highly committed towards taking their employment on, it is absolutely possible. Fundamentally, there's no reason why DID should stop a person having a job. Pure and simple, that's how we look at it. We look at the potential for the person and we say, are you able to work? Do you want to work? Brilliant, let's support you in doing that. Then you have the difficulties that I think Faith is talking about, is that she wants to get into a job, she wants to work, but something is happening behind the scenes, which means that that employment is not working. Excuse the pun. And what that might be is that you get up for work, but you don't actually get to work. So at some point between getting up for work, getting dressed, having breakfast, getting in the car or public transport, you're not getting there. The dissociation is happening, and sometimes you're going in this direction in order to go to work and the dissociation is taking you someplace else. So it could be that the alters are then dissociating into the present moment and preventing you even getting to work, and that might happen enough times that you end up losing your job. Or it could be that alters are coming out during the work and saying things or doing things which cause you to lose your job. Things might be being said, things are done or not done, which can place employment at risk. So what we do in those circumstances, if we try and do a bit of a survey of the alters to say, well, who actually wants this job? Because actually it's a very, very straightforward question that people don't always ask, which is how many of the alters within the system actually want to be in this job? How many want to get up in the morning, get dressed, and go and do the job? Because the answer is always going to be variable. There will be some that don't. Now, if they have power, if they have influence and control, they may prevent the person from going to work. And by the person, I mean the sort of the overall body that is attending the workplace. So if alters do not want to go to work and they have the ability to take over, to switch into the system and move the person from one place to another, then they can prevent that work taking place. This is especially common with child parts and alters who simply find work boring or dull, or it's too adult and they're not interested, or their action system is designed for something completely different. So effectively, the internal system is trying to go in one direction and the person with the job is trying to go in another system. That's a conflict arrangement. You've got a push-pull arrangement, and it will probably mean that that work isn't going to be very successful. Again, what we do then with people is we sit them down with the internal system, with all the parts, as many as that will come to the table and join and cooperate in the conversation, and do a survey and work out who wants to be in work, who doesn't, who cares, who doesn't, who's capable of doing it, who shouldn't be doing it. Let's say if you're a forklift truck driver, you really don't want child parts being present in the workplace. Absolutely not. It's too dangerous for the self and for potentially members of the public or other employees in the company. So we have to cooperate. And the advice that I would give you, Faith, is to be able to say, right, if you've got a job that you really want to do and you've got an internal system that is not allowing that to take place, then the thing to do is to cooperate, to organise a situation, in which case you can say to the internal system, I'm going to work. You can't be present in the workplace between 9 and 5, let's say. It's not for you. But when we get home, I absolutely promise that we will dedicate time to the things that you want to do. So you've got to find out if they're willing to tell you what they want to do, what kind of activities, what kind of interests they may have, and you make a promise. Do not come to work with me. Sit in the background, stay put, however you do it, and there's loads of ways of being able to organise that within therapy. But when we get home, then it's time for you. I will dedicate time for you if you allow me to have dedicated time for myself. It's a negotiation of time. This is a seriously important thing that we get involved in conversations with over and over again within the clinic, to negotiate these responsible time frames so that one part is doing one thing, one alter is doing one thing, person is doing something else, and it's done smoothly and with cooperation and not with conflict. And if you get home from the end of the day and the alters have not been present at work, you have not been sacked from your job, you've not got into arguments, you've not found yourself in a place that you shouldn't be, you sit down and you appreciate and you demonstrate gratitude to everybody within the system for having a role within that, and then you offer them time for their activities and their enjoyment. It might mean you don't have an awful lot of free time to yourself because you've been at work. You've got to come home. You've got to then dedicate maybe several hours to parts within the internal system to have their time. But so be it. That's the cost of being able to negotiate and cooperate within this. So ultimately, to conclude, absolutely it's possible for DID and employment to be in the same place, right? There's no reason why someone with DID should not be in a job, unless the job is not safe or the person is too disabled, or the nature of the dissociation, let's say the chaotic presentation of that dissociation, makes it impossible for work to be done. That would be fine, right? So therefore, to try and force work into that would probably be a mistake, and maybe work is for the future, and actually therapy, organising and structuring the dissociation in the present should be the focus. And that's to be negotiated and be considered depending on your life circumstances. You might want to tell your boss and your colleagues, you might not, depending on whether that feels safe or appropriate to do so. If work is present and alters are turning up and causing difficulty, without intent, but that simply might be the case, then to try and negotiate with each and every individual part to work out how that can change so that employment takes place, because that then allows bills to be paid, things to be bought, life to be structured and organised in a meaningful way. Hopefully I've answered your question, Faith. The actual way of being able to work this, there's going to be many, many different factors. I will always say this is a conversation that should take place within therapy. I know that's not available to everyone, but that's the safe and most reliable way to approach this. But if you're in a job and you can't maintain that work because of your dissociation, firstly, maybe you shouldn't be in a job because it's not safe for you or maybe for other people to do so. And that's a hard decision to make, but might have to be the best one in the short term. If it is safe to be in that job, brilliant. In which case, structure, organise and cooperate and see how that goes. So I hope that's really helped with the question, Faith. Thank you ever so much. And be really interested to see what people think about this in the comments. So I'll have a read as and when people choose to write those things. Thank you ever so much. Please keep liking and subscribing if you haven't already done so to the CTAG channel, and we'll keep producing content. So between now and the next video, please do take great care.